A varicocele is a dilated set of veins in the skin of the scrotum. And typically this is caused by a vein that's higher up in the body, not effectively draining the blood out of the scrotum. This vein is generally the gonadal vein or the spermatic vein. Most often this occurs on the left side, so men will notice that there is what's typically described as a bag of worms appearance of their scrotum. This looks somewhat unsightly and can be painful. The pain is generally worse at the end of the day when the vein has not been draining all day and stretches out the veins, and then it's better in the morning when the blood has more time to drain back up through the heart. The treatment for this is what's called an embolization, and that's what we do at Summit Interventional Radiology. It's different than traditional surgical techniques, which are a ligation of the vein that's not working. And the embolization is an outpatient procedure, so you get to go home the same day. People will typically come in about an hour before their procedure, have an IV placed, ask any last-minute questions about the procedure, and then we'll go do the varicocele embolization. Like other embolizations, this one is done through a vein using a combination of coils, which are these small, tiny metal fibers that are sized to the vein, and they will be used to block off blood flow in the vein, in this case divert blood flow away from the vein that's not working and towards veins that are working. We also use a liquid that's called a detergent, and this will block off any other veins that are potentially connected to the vein that's not working and can be a cause for early recurrence. This process will take about an hour or 45 minutes depending on whether we're doing one side or both sides. Afterwards, patients will return to the recovery room, hang out for about an hour while they're waking up for the anesthesia, and then they'll be able to go home. Often patients will feel some aching in the area that the vein was embolized, and this should pass within a couple of days. And then rather quickly, men will notice that their varicocele subsides and they no longer have this bag of worms appearance in their scrotum, and the pain and aching that they feel when they're walking around or sitting all day resolves.